Swadikap and good afternoon once again. Today is Thursday, the 14th of January 2021, and this is the English language summary of the daily press briefing here at the Center for COVID Situation Administration as always. So I'll start off first with the general situation for today as recorded for the number of new cases for today. How many people have active cases of COVID in Thailand as of today? The answer is 3,533. Today we recorded 271 new cases, while there were 717 new recoveries. So doing the math, we have now cumulative number of cases in Thailand, 11,262 since last year. But of course, as I mentioned yesterday, the main point is that if someone asks how many active cases, how many people in Thailand actually have COVID at the moment, up to today, the answer is 3,500 plus. Today we also recorded 2 new fatalities, unfortunately. The 68th case of fatality is a 71-year-old British male, a British national, with existing conditions, health conditions, such as diabetes, lung cancer, and hypothyroid. He arrived in Thailand on the 7th of December and began having symptoms on the 11th of December last year. The 69th fatality, the second new fatality case, is a 53-year-old Thai male from Pathum Thani province with existing conditions, that is diabetes. He traveled to various provinces in the past weeks, months, and also basically in the central region of Thailand, but he traveled by private transportation, a private car. Some observations from the briefing of the spokesperson just now. Firstly is that, of course, looking at the numbers, most of the new cases that we have so far are from the new wave, more than the older, the first wave last year. The southern part of Thailand, the southern provinces of Thailand are actually doing quite well in controlling COVID, because the provinces more or less have not been included in the highly controlled, high risk or red or level 1 provinces. And in terms of provinces, there remains 17 provinces that have not found any COVID case at all. So the southern provinces have been doing quite well, even though our neighboring country, Malaysia, has been finding new cases in the hundreds or thousands per day. On the enforcement, the spokesperson mentioned about the checkpoints in terms of enforcement, that enforcement is being done in a more stricter and rigid manner. In some provinces, the checkpoints along the roads have been done on a massive scale. In some areas, up to 32,000 people have been going through the checkpoints, and they have been checked thoroughly in terms of temperature check and the like. In terms of Mo Chana application, the digital government agency is addressing various issues to improve the efficiency of the Mo Chana application, and the numbers show that more and more people are using Mo Chana application, up to over 5 million persons downloading the application and using the application to point now. Some important information, firstly on the national vaccination plan, just some updates on that. Earlier this week, the National Communicable Disease Committee approved the preliminary national vaccination plan. This means that the approved plan disbursement of the first batch of 200,000 Sinovac vaccine in February 2021 for those identified to be among the high-risk groups in the 5 provinces most affected by the recent wave. The high-risk groups include medical and public health personnel, patients with existing health conditions, citizens under 60 years of age, and staff involved in disease control. So as the criteria for the initial rollout of the vaccines is based on health considerations and addressing high-risk groups, the legal status or nationality of the person is not the prioritized factor to determine whether a person shall be inoculated or not. So the nationality is not the main criteria. The main criteria is, of course, as I mentioned, medical personnel, persons 60-year-old and older, those with existing health conditions and the like. So the national vaccination plan, however, will have to be under review when the situation progresses and by that time when we receive the vaccine in Thailand and we receive further batches of the vaccines. On the procurement, the government has been in negotiation with various entities, companies, AstraZeneca, as well as other pharmaceutical companies for months. The procurement plan is based on scientific and medical assessment made by the Department of Disease Control. The primary consideration for Thailand on the issue of vaccine is indeed on safety. The secondary condition is on controlling the spread of the epidemic consideration for vaccine. Therefore, vaccine safety and vaccine efficacy are the most important considerations for the officials at this time and will be a factor in how fast we can disperse the vaccines for the time And for the time being, Sinovac and AstraZeneca have submitted their request for approval to the Thai FDA, who will examine their safety and efficacy from the raw data gathered from clinical trials. So all in all, we are looking into evaluating the efficacy of the vaccines, of course, before they arrive in February and then until May and in various batches. And the FDA of Thailand has already made the request to some companies like Sinovac, the first batch, to provide us with more detailed information on the clinical trials. On manufacturing, the vaccine developed by AstraZeneca is also being domestically manufactured by Siam Bioscience. The company has been carefully selected based on a number of factors. There was a rigorous vetting process in place for Siam Bioscience to be the base of the production. And for more information on the vaccine policy and plan, we will be having some information on a program today on NBT channel 11, number 2 actually on your TV screen, at 2 p.m. today on NBT channel 11, a program by Dr. Yong Puwarawan, the head of the Center of Clinical Virology of Chulalongkorn University Hospital. He'll give an interview and run the program there, and we might have a recap for you in English on another day regarding the update on the vaccines. Another piece of information important is on the infection in the workplace. The Ministry of Public Health noticed that there were a high number of confirmed cases those who have been infected from their own workplace. In most of these cases, the infection has spread from person to person in the office from someone who was waiting for the result of the test but continued to go to work as usual. So when people take the test and they have not received the result yet, they go to work. That's the problem. And when they go to work, they might be asymptomatic, and that's the moment when they spread the infection from workplace to workplace. So it's very important to work from home, and for offices, for managers, for CEOs to be aware of this risk of people infecting each other in the office. Right? So work from home is something that various organizations, companies can look into further. It's very important, and we encourage that fully. So the Ministry of Public Health has encouraged all workplaces, including factories, offices, to instruct their employees, to observe 14-day self-quarantine if they have been in close contact with infected persons or if they have traveled to high-risk areas. The person who is considered to be at risk should seek medical advice from local health care facilities and should not travel outside of their vicinity. The workplace must also provide alcohol gel, of course, and temperature checking to ensure that all employees are provided with face masks and working area is cleaned and disinfected thoroughly. The last piece of information, very important, which the spokesperson had highlighted, is about factory quarantines. So we're familiar now with a lot of new terms, alternative state quarantine in the past year, organizational quarantine, where some companies and embassies and educational institutions have entered into that scheme of becoming an organizational quarantine, OQ. So now we have factory quarantine, FQ perhaps. So one of the factories that were affected by COVID is, I have to mention the name, Pattaya Food Industries in Samut Sakhon. It's in Samut Sakhon, but the name is Pattaya Food Industries. This factory has been responding quickly to cooperate with authorities and with the Samut Sakhon provincial administration to set up a field hospital, or what we'll call now a factory quarantine, because it's placed in their own factory. It can accommodate up to 600 people to isolate workers who tested positive for COVID, their own workers. This is a good example of public-private cooperation to effectively reduce the number of transmissions. And we had some images shown to you. The factory itself is divided into various zones. The red zone is where the infected factory workers, their employers, were placed. The yellow zone is perhaps I'll call the buffer zone, where the health officials would be changing into PPE suits and the transit area, so to speak. And the green zone is green, so that's where the safe zone is within the factory. So the red, the yellow, and the green zone, there you see it again on screen, is how this particular factory is cordoning off people who have COVID and having, of course, medical treatment for them in the red zone area. A la field hospital, like a field hospital, but it's a factory quarantine. This is very good cooperation. And of course, in the red zone in that factory, there are facilities, separate facilities for those who are infected in terms of course, laboratories for sleeping, for eating, and the like. So these field hospitals intended to serve also, to treat also asymptomatic patients. They can reduce the risk of medical personnel and other patients who visit general hospitals. Instead of going to general hospitals, stay in your own factory, in a factory quarantine. These field hospitals or factory quarantine also help reduce the risk of infection in the local community as well, not going out to the local community in Samut Sakhon as an example. And eventually, of course, lower the death rate. So therefore, all sectors of society encouraged to facilitate the setup of, to cooperate in the facilitation for the setup or building of field hospitals. The public can be assured that all hospitals, field hospitals, hospitals, factory quarantines are up to medical standards, are up to the medical standards in the Thai healthcare system, and under supervision, of course, with the appropriate health officials. So finally, I'd just like to note that when we mentioned that the spokesperson in the Thai edition, Dr. Thuisin, sometimes would have to go inspect various provinces on site. So we will be having someone for the Thai language briefing in his place during those days, a few number of days. So the spokesperson introduced Dr. Apisamai Si Rangsan just now. Yes, you have her on screen there. Dr. Apisamai Si Rangsan, who will serve in the CCSA spokesperson team as the assistant spokesperson, and perhaps give us the daily briefing in Thai during some days when Dr. Thuisin is unavailable. But of course, for the English language version, I guess you'll have to bear with me for now. I hope that the English language briefing that we have had since we started on the 24th of December, actually, Christmas Eve, right after the 20th of December when we found the first new wave case in Samut Sakhon. So we started 24th of December until today, every day. We hope that it has been useful, and we will continue doing it for the English language community, expats, those who call Thailand home, the foreign media, and those who are viewing this broadcast on social media from around the world. Don't worry, we won't go anywhere until we solve COVID together. Thank you for your attention. Have a pleasant day. Sawadee krap.